If you've ever felt overwhelmed at the thought of going outside, using public transport, or being in a crowded place, you're not alone. Many people assume agoraphobia is just a fear of open spaces, but in reality, it's a much more complex condition. Agoraphobia is a fear of being in situations where you might feel trapped, helpless, or unable to get help if something goes wrong. In this video, I'm going to take you through what agoraphobia is, the symptoms it can cause, what it might lead to, how it's diagnosed, and what treatments can help. Now, whether you're trying to understand your own experiences or you're trying to support someone else, this video is here to help you. So first of all, what is agoraphobia? Well, agoraphobia is a type of anxiety disorder. People with agoraphobia often feel intense fear in situations where they believe escape would be difficult or help might not be available. Now, this could mean crowded places, public transport, shops, or even being far from home. Now, for some people, just the thought of leaving the house can be deeply stressful. Others may be able to go short distances, but only if they're with someone they trust. Now, it's not about laziness, weakness, or simply being shy. It's a condition that can affect every part of daily life. Now, agoraphobia often involves panic attacks, sudden, intense bursts of fear with physical symptoms such as a racing heart or dizziness. Now, over time, this can lead people to avoid situations altogether, a pattern that is known as avoidance behaviour. So what are the symptoms of agoraphobia? Well, agoraphobia symptoms fall into three main categories: physical, cognitive, and behavioural. Now, physical symptoms are often the same as those seen during a panic attack, and they might include things like a rapid heartbeat, rapid breathing, or what we call hyperventilating, feeling hot or sweaty, feeling sick, or what we call feeling nauseous, dizziness or feeling faint, trembling, chest pain or discomfort, difficulty swallowing, or even ringing in the ears and potentially loose poo, which is known as diarrhea. Now, it's important to note that some people rarely experience these symptoms because they avoid situations that do trigger them. Now, cognitive symptoms are the second bucket. These are the thoughts and fears that go alongside the physical reactions that we just spoke about. Now, you might fear that a panic attack will make you lose control or look foolish. You won't be able to escape a situation if you panic. You might faint, collapse, or even die. People will stare at you or judge you. You'll be trapped or abandoned. Now, some people also feel that they couldn't cope or survive without others. They might have a fear of being alone at home or a general sense of dread, even without a clear trigger. Now, the third bucket are behavioural symptoms. Now, these include avoiding crowded places, queues, or public transport, being housebound or only going out with a companion, refusing to go further than a certain distance from home, changing routines or using workarounds. So, for example, ordering groceries online instead of going to the shop. Now, everybody's experience is slightly different. Some people might just feel mildly anxious in certain places, whereas others may be completely unable to leave their home for long periods of time. So it obviously can be a very debilitating condition. So what causes agoraphobia? Well, agoraphobia often starts as a complication of panic disorder, a condition where people experience repeated panic attacks. Now, if someone has a panic attack in a particular setting, such as on a bus or in a supermarket, they might start to avoid that place in case it happens again. Now, over time, that fear can grow and spread to other situations, but not everybody with agoraphobia has had panic attacks. Some people, it's linked to other fears, such as crime or terrorism, illness, being judged or embarrassed, or getting into an accident. Now, several risk factors are known to increase the chances of developing agoraphobia. Now, these can include a traumatic childhood event, such as bereavement or abuse, a history of anxiety, depression, eating disorders, or substance misuse, perhaps a major life stressor like a divorce or job loss, being in a controlling or unhappy relationship, or a tendency to have strong fight or flight responses. Now, it's not always clear why someone develops agoraphobia, but what's important is that it's not your fault and it can be treated. So how is agoraphobia diagnosed? Well, if you think you might have agoraphobia, it's important to speak to your doctor. If leaving the house feels too difficult, you might be able to book a phone or video consultation. Now, typically your doctor will ask you about what kinds of situations you find stressful, whether you've changed your behaviour to avoid them, how the symptoms are affecting your daily life. They might also ask you questions like, do you need someone to come with you when you go out? Or Are there places you avoid completely, or have you stopped doing certain activities altogether? Now, sometimes they might also do a physical exam or run basic tests such as some basic blood tests to rule out other conditions such as thyroid problems that can potentially mimic anxiety symptoms. Now, if necessary, they might refer you to a mental health specialist or a therapist for more detailed assessment. So how is agoraphobia treated? Well, agoraphobia is usually treated in steps, starting with self-help and then moving to talking therapies and then medication if needed. And we'll briefly discuss each of these in turn now. So firstly, starting with self-help techniques. Well, these are strategies that you can use to manage panic symptoms and build confidence. So some of these include staying in place during a panic attack rather than fleeing, and focusing on something in your environment, such as counting items on a shelf or tracking the second hand of your watch. They might also encourage you to breathe slowly and deeply, counting to 3 as you inhale, and then holding the breath for 3 seconds and then exhaling for 3 seconds. You can also challenge your thoughts and remind yourself that your fears are a response to anxiety and not danger. It might also be helpful to visualize a calming place or experience to shift focus, and try not to fight the attack, accept that it will pass even if it feels uncomfortable. Lifestyle changes can also help, so regular exercise to boost mood and relieve stress, having a balanced diet, and importantly, avoiding alcohol, recreational drugs, and caffeine. Now, if symptoms don't improve with self-help, talking therapy is often recommended. Now, in the UK, you can self-refer to NHS talking therapies without actually going to your GP. Now, the most common approach is cognitive behavioural therapy, or CBT. CBT helps you change unhelpful thought patterns and develop new ways of responding to fear. CBT is often combined with what we call exposure therapy, so gradually facing feared situations in a safe, supported way. This might begin with small goals like walking to your local shop, and those can build up over time. Now, a full course usually includes around 12 to 15 sessions, each lasting about an hour. Now, if therapy and lifestyle changes aren't enough on their own, medication can potentially help. The most commonly used medicines are selective serotonin reuptake inhibitors, or SSRIs, the same class of drugs often used for anxiety and depression. Now, these may take a few weeks to start working, and you'll be monitored for side effects. In more severe cases, medication can be used alongside therapy, not instead of it. So what is the outlook for agoraphobia? Well, agoraphobia can be incredibly limiting, but with the right support, people can and they do recover. Progress may take time and setbacks are normal, but many people improve with a combination of therapy, lifestyle changes, and when needed, medication. The key is not trying to manage alone. If you are struggling, please do reach out to your GP, a mental health service, or someone you trust. Now, if you'd like to explore this topic further, I can recommend a few useful resources. Firstly, NHS Talking Therapies, which is a free UK-based service offering CBT and other support for anxiety disorders. Anxiety UK is also a fantastic resource offering tools, helplines, and peer support for those living with agoraphobia and panic disorders. And Mind is a great UK charity with some excellent resources on their website. If you did find this video helpful, or if you'd like to share your experiences with agoraphobia to help others, please do leave a comment below, and why not check out this video next.